The Nclex is designed to test your clinical judgment, not just your ability to memorize facts. These 50 of the most missed Nclex-style questions cover high-yield topics that students commonly struggle with, including prioritization, pharmacology, delegation, infection control, and emergency nursing. Use each rationale and strategy to strengthen your test-taking skills and build confidence for exam day. Question 1. A nurse is caring for 4 clients. Which client should the nurse assess first? A client with a blood pressure of 138/84 mmHg after receiving antihypertensive medication. B. A client with COPD who is suddenly restless and has an oxygen saturation of 84%. C. A client with diabetes who requests a bedtime snack. D. A client 2 days after surgery who rates incisional pain as 5/10. Correct answer, B. A client with COPD who is suddenly restless and has an oxygen saturation of 84%. Rationale. Restlessness and a low oxygen saturation are signs of acute hypoxia that require immediate intervention. Airway and breathing problems always take priority over stable clients. Strategy. Apply the ABCs, airway, breathing, circulation, when prioritizing care. Choose the client with the greatest threat to life. Question 2. A nurse is preparing to administer insulin to a client with a blood glucose level of 58 mg per deciliter. What is the nurse's priority action? A. Administer the insulin as prescribed. B. Give the client a fast-acting source of glucose if the client is conscious. C. Encourage the client to exercise. D. Recheck the blood glucose in 8 hours. Correct answer, B. Give the client a fast-acting source of glucose if the client is conscious. Rationale. A blood glucose level of 58 mg per deciliter indicates hypoglycemia and requires immediate treatment. Giving insulin would worsen the condition. Strategy. Always identify abnormal laboratory values first. Treat hypoglycemia before administering insulin. Question 3. A nurse enters a client's room and finds the client unresponsive. What should the nurse do first? A. Begin chest compressions. B. Check for responsiveness and call for help. C. Obtain vital signs. D. Document the findings. Correct answer, B. Check for responsiveness and call for help. Rationale. The nurse must quickly confirm unresponsiveness and activate the emergency response system. This ensures rapid assistance before further interventions. Strategy. Follow the basic life support sequence. Always assess first unless the client is clearly pulseless. Question 4. A client receiving a blood transfusion develops chills and back pain. What is the nurse's first action? A. Slow the transfusion rate. B. Stop the blood transfusion immediately. C. Administer acetaminophen. D. Continue monitoring. Correct answer, B. Stop the blood transfusion immediately. Rationale. Chills and back pain may indicate an acute hemolytic transfusion reaction. The transfusion must be stopped immediately to prevent further complications. Strategy. When transfusion reactions occur. Question 5. A nurse is caring for a client with chest pain. Which assessment finding requires immediate intervention? A. Pain rated 3 out of 10 after nitroglycerin. B. Crushing chest pain with diaphoresis. C. Heart rate of 82 beats/min. D. Blood pressure of 128/78 mmHg. Correct answer, B. Crushing chest pain with diaphoresis. Rationale. Crushing chest pain with sweating is highly suggestive of an acute myocardial infarction. Immediate evaluation and treatment are necessary. Strategy. Recognize classic signs of life-threatening cardiac emergencies. Prioritize symptoms indicating reduced cardiac perfusion. Question 6. A nurse is caring for a client who suddenly develops slurred speech and right-sided weakness. What is the nurse's priority action? A. Assist the client to ambulate. B. Activate the stroke protocol immediately. C. Offer the client food and water. D. Reassess in 1 hour. Correct answer, B. Activate the stroke protocol immediately. Rationale. Sudden slurred speech and unilateral weakness are classic signs of an acute stroke. Rapid intervention improves the client's chance of recovery. Strategy. When you recognize stroke symptoms, think time is brain. Early treatment is the priority. Question 7. Which client should the nurse see first? A. A client with a temperature of 100.2 degrees Fahrenheit 37.9 degrees Celsius. B. A client with asthma who has audible wheezing and difficulty speaking. C. A client requesting pain medication. D. A client awaiting discharge instructions. Correct answer, B. A client with asthma who has audible wheezing and difficulty speaking. Rationale. Difficulty speaking due to shortness of breath indicates severe airway compromise. This client is at immediate risk for respiratory failure. Strategy. Prioritize clients with airway or breathing problems using the ABC framework. Question 8. A client receiving heparin develops bleeding gums and blood in the urine. Which medication should the nurse anticipate administering? A. Vitamin K. B. Protamine sulfate. C. Naloxone. D. Atropine. Correct answer, B. Protamine sulfate. Rationale. Protamine sulfate is the antidote for heparin overdose. It reverses the anticoagulant effects and helps control bleeding. Strategy. Memorize common antidotes. Nclex frequently tests medication reversal agents. Question 9. Which finding requires immediate follow-up after thyroid surgery? A. Mild incisional discomfort. B. Hoarseness with difficulty breathing. C. Small amount of drainage on the dressing. D. Sore throat. Correct answer, B. Hoarseness with difficulty breathing. Rationale. Difficulty breathing may indicate airway swelling or a hematoma compressing the trachea. This is a life-threatening emergency. Strategy. After neck surgery, always prioritize airway complications. Question 10. Which client is at the highest risk for developing pressure injuries? A. A client who walks independently. B. A bedridden client with poor nutrition. C. A client who exercises daily. D. A client with seasonal allergies. Correct answer, B. A bedridden client with poor nutrition. Rationale. Immobility and poor nutrition significantly increase the risk of skin breakdown and pressure injuries. Strategy. Think of pressure injury risk factors. Immobility, poor nutrition, and decreased sensation. Question 11. A nurse is caring for a client with suspected bacterial meningitis. Which action is the priority? A. Encourage family visits. B. Initiate droplet precautions. C. Offer a regular diet. D. Reduce fluid intake. Correct answer, B. Initiate droplet precautions. Rationale. Bacterial meningitis is highly contagious through respiratory droplets. Isolation protects healthcare workers and other clients. Strategy. Know which infections require droplet, airborne, or contact precautions. Question 12. A nurse is assessing a client with heart failure. Which finding indicates fluid overload? A. Dry mucous membranes. B. Bilateral crackles in the lungs. C. Weight loss of 3 kilograms. D. Bradycardia. Correct answer, B. Bilateral crackles in the lungs. Rationale. Crackles occur when fluid accumulates in the lungs. This is a common sign of worsening heart failure. Strategy. Listen for lung sounds when evaluating fluid status. Question 13. Which laboratory value requires immediate intervention? A. Potassium 2.8 milliequivalent/L. B. Sodium 138 milliequivalent/L. C. Hemoglobin 13G/DL. D. Glucose 102 mg per deciliter. Correct answer, A. Potassium 2.8 milliequivalent/L. Rationale. Severe hypokalemia can cause life-threatening cardiac dysrhythmias. Prompt replacement is necessary. Strategy. Know normal laboratory values and identify those that are immediately dangerous. Question 14. A client receiving morphine becomes difficult to arouse and has a respiratory rate of 8 breaths/min. Which medication should the nurse administer? A. Protamine sulfate. B. Naloxone. C. Flumazenol. D. Vitamin K. Correct answer, B. Naloxone. Rationale. Naloxone rapidly reverses opioid-induced respiratory depression. Early administration can be life-saving. Strategy. Always assess respirations before giving opioids and know the antidote. Question 15. A nurse is delegating care to an assistive personnel, AP. Which task is appropriate? A. Assess lung sounds. B. Teach insulin administration. C. Obtain routine vital signs on a stable client. D. Evaluate pain medication effectiveness. Correct answer, C. Obtain routine vital signs on a stable client. Rationale. Routine tasks that do not require nursing judgment can be delegated to the AP. Assessment and teaching remain the nurse's responsibility. Strategy. Remember, APs collect data but do not assess, teach, or evaluate. Question 16. A client suddenly develops chest pain and shortness of breath after surgery. Which complication should the nurse suspect? A. Pneumonia. B. Pulmonary embolism. C. Urinary tract infection. D. Appendicitis. Correct answer, B. Pulmonary embolism. Rationale. Sudden chest pain and dyspnea after surgery are classic signs of a pulmonary embolism. Immediate medical attention is required. Strategy. Postoperative clients with sudden respiratory symptoms should make you think pulmonary embolism. Question 17. A nurse is caring for a client with severe hypoglycemia who is unconscious. Which action is appropriate? A. Give orange juice by mouth. B. Administer 4-dextrose or glucagon as prescribed. C. Encourage exercise. D. Delay treatment until laboratory confirmation. Correct answer, B. Administer 4-dextrose or glucagon as prescribed. Rationale. An unconscious client cannot safely swallow. 4-dextrose or glucagon rapidly raises blood glucose levels. Strategy. Never give oral fluids or food to an unconscious client. Question 18. A client has a serum potassium level of 6.5 milliequivalent/L. Which ECG change should the nurse expect? A. Flattened T waves. B. Tall, peaked T waves. C. Short PR interval. D. ST segment depression only. Correct answer, B. Tall, peaked T waves. Rationale. Hyperkalemia commonly causes tall, peaked T waves and can progress to fatal dysrhythmias. Strategy. Associate potassium abnormalities with their classic ECG findings. Question 19. A nurse is caring for a client with pneumonia. Which assessment finding suggests improvement? A. Increasing oxygen saturation. B. Worsening crackles. C. Increasing respiratory distress. D. Cyanosis. Correct answer, A. Increasing oxygen saturation. Rationale. Improved oxygen saturation indicates better gas exchange and recovery from pneumonia. Strategy. Look for objective evidence of improving respiratory function. Question 20. A client states, I don't think I can go on living anymore. What is the nurse's priority response? A. Why do you feel that way? B. Assess the client for suicidal thoughts and plans. C. Leave the client alone to rest. D. Tell the client to think positively. Correct answer, B. Assess the client for suicidal thoughts and plans. Rationale. Any statement suggesting hopelessness or a desire to die requires immediate suicide risk assessment. Early identification allows the nurse to implement appropriate safety measures. Strategy. Never ignore or minimize statements about death or suicide. Assess first, ensure safety, and notify the healthcare team as appropriate. Question 21. A nurse is caring for a client with a newly inserted chest tube. Which finding requires immediate intervention? A. Gentle tidling in the water seal chamber. B. Continuous bubbling in the water seal chamber. C. Mild discomfort at the insertion site. D. Small amount of drainage. Correct answer, B. Continuous bubbling in the water seal chamber. Rationale. Continuous bubbling usually indicates an air leak in the chest tube system. The nurse should assess the tubing and connections immediately. Strategy. Know the difference. Tidling is expected, but continuous bubbling suggests an air leak. Question 22. Which client can be safely assigned to the licensed practical/vocational nurse, LPN/LVN? A. A client requiring discharge teaching. B. A stable client needing routine dressing changes. C. A newly admitted client with chest pain. D. A client requiring an initial assessment. Correct answer, B. A stable client needing routine dressing changes. Rationale. LPN/LVNs can care for stable clients and perform routine procedures. Initial assessments and teaching remain the RN's responsibility. Strategy. Delegate stable, predictable clients to the LPN/LVN. Question 23. A client receiving furosemide reports muscle weakness. Which electrolyte imbalance should the nurse suspect? A. Hyperkalemia. B. Hypokalemia. C. Hypernatremia. D. Hypercalcemia. Correct answer, B. Hypokalemia. Rationale. Loop diuretics increase potassium loss through the kidneys. Muscle weakness is a common symptom of low potassium. Strategy. Remember, loop diuretics often lower potassium levels. Question 24. A nurse is caring for a client with increased intracranial pressure. Which finding is most concerning? A. Mild headache. B. Unequal pupils. C. Slight nausea. D. Decreased appetite. Correct answer, B. Unequal pupils. Rationale. Unequal pupils may indicate brain herniation or worsening neurological status. Immediate intervention is required. Strategy. Prioritize neurological changes that suggest increasing intracranial pressure. Question 25. A client with pneumonia suddenly becomes confused. What is the nurse's priority action? A. Assess oxygen saturation. B. Encourage oral fluids. C. Reduce room lighting. D. Offer a snack. Correct answer, A. Assess oxygen saturation. Rationale. Confusion may be an early sign of hypoxia. Oxygenation should be assessed immediately. Strategy. Sudden mental status changes often indicate inadequate oxygen delivery. Question 26. A nurse is teaching a client taking warfarin. Which statement indicates correct understanding? A. I'll eat unlimited spinach every day. B. I'll report unusual bleeding immediately. C. I'll stop taking the medication when I feel better. D. I don't need blood tests. Correct answer, B. I'll report unusual bleeding immediately. Rationale. Warfarin increases bleeding risk. Clients should report bleeding and attend regular INR monitoring. Strategy. Warfarin questions often focus on bleeding precautions and INR monitoring. Question 27. Which action is appropriate before administering digoxin? A. Assess bowel sounds. B. Check the apical pulse for 1 full minute. C. Measure urine output. D. Assess visual acuity only. Correct answer, B. Check the apical pulse for 1 full minute. Rationale. Digoxin can slow the heart rate. The medication should be withheld and the provider notified if the pulse is below the prescribed parameter. Strategy. Associate digoxin with pulse assessment before administration. Question 28. A client has a serum sodium level of 122 milliequivalent/L. Which symptom should the nurse expect? A. Confusion. B. Increased alertness. C. Hypertension only. D. Dry cough. Correct answer, A. Confusion. Rationale. Hyponatremia commonly affects the nervous system, causing confusion, headache, and seizures in severe cases. Strategy. Low sodium primarily affects brain function. Question 29. Which client should be placed in airborne precautions? A. A client with influenza. B. A client with pulmonary tuberculosis. C. A client with MRSA wound infection. D. A client with Clostridioides difficile. Correct answer, B. A client with pulmonary tuberculosis. Rationale. Tuberculosis spreads through airborne particles and requires an airborne isolation room and an N95 respirator. Strategy. Remember the Nclex airborne diseases, TB, measles, and chickenpox, varicella. Question 30. A postoperative client reports calf pain and swelling. What should the nurse suspect? A. Deep vein thrombosis. B. Muscle strain. C. Arthritis. D. Cellulitis. Correct answer, A. Deep vein thrombosis. Rationale. Calf pain, swelling, and tenderness are classic signs of deep vein thrombosis. Early treatment prevents pulmonary embolism. Strategy. Postoperative clients are at increased risk for blood clots. Question 31. A nurse is caring for a client with severe burns. Which assessment finding is the priority? A. Pain level. B. Airway patency. C. Appetite. D. Sleep pattern. Correct answer, B. Airway patency. Rationale. Burns involving smoke inhalation may rapidly cause airway swelling. Maintaining a patent airway is the highest priority. Strategy. For burn questions, always think airway first. Question 32. A nurse is preparing to administer potassium chloride for. Which action is correct? A. Administer it as in 4-push. B. Dilute it and infuse using a pump. C. Mix it with blood products. D. Give it rapidly over 5 minutes. Correct answer, B. Dilute it and infuse using a pump. Rationale. For potassium must never be given as a rapid 4-push because it can cause fatal cardiac dysrhythmias. Strategy. Remember, for potassium is always diluted and infused slowly. Question 33. Which finding indicates improvement in a client with heart failure? A. Weight gain of 3 kilograms. B. Reduced peripheral edema. C. Increased shortness of breath. D. Crackles throughout both lungs. Correct answer, B. Reduced peripheral edema. Rationale. Decreased edema indicates that excess fluid is being removed and cardiac function is improving. Strategy. Look for signs that fluid overload is resolving. Question 34. A client receiving chemotherapy has a neutrophil count of 400/mm superscript 3. Which action is most important? A. Place fresh flowers in the room. B. Implement neutropenic precautions. C. Encourage raw fruits and vegetables. D. Limit hand hygiene. Correct answer, B. Implement neutropenic precautions. Rationale. Severe neutropenia places the client at high risk for infection. Protective measures help reduce exposure to pathogens. Strategy. Low neutrophils equal high infection risk. Question 35. Which finding should the nurse report immediately in a client receiving magnesium sulfate? A. Respiratory rate of 10 breaths/min. B. Mild flushing. C. Warm skin. D. Slight nausea. Correct answer, A. Respiratory rate of 10 breaths/min. Rationale. Respiratory depression is a serious sign of magnesium toxicity and requires immediate intervention. Strategy. Monitor respirations, reflexes, and urine output during magnesium therapy. Question 36. Which client has the highest priority? A. A client with a blood glucose of 250 mg per deciliter. B. A client with stridor after extubation. C. A client requesting assistance to the bathroom. D. A client waiting for breakfast. Correct answer, B. A client with stridor after extubation. Rationale. Stridor indicates upper airway obstruction and can rapidly become life-threatening. Strategy. Airway emergencies always take priority. Question 37. A nurse is caring for a client with a nasogastric tube. Which finding requires immediate action? A. Sudden difficulty breathing after tube insertion. B. Mild throat irritation. C. Small amount of gastric drainage. D. Client requests water. Correct answer, A. Sudden difficulty breathing after tube insertion. Rationale. Respiratory distress may indicate accidental placement of the tube into the airway. Immediate assessment is required. Strategy. Always verify tube placement before use. Question 38. Which client statement indicates effective teaching about hypertension? A. I'll stop my medication when my blood pressure is normal. B. I'll take my medication even if I feel well. C. I'll double my dose if I miss one. D. I only need treatment when I have headaches. Correct answer, B. I'll take my medication even if I feel well. Rationale. Hypertension often has no symptoms. Medication should be taken consistently to prevent complications. Strategy. Avoid answers suggesting medication changes without provider guidance. Question 39. A client develops hives and difficulty breathing after receiving penicillin. What should the nurse suspect? A. Mild side effect. B. Anaphylaxis. C. Expected reaction. D. Anxiety. Correct answer, B. Anaphylaxis. Rationale. Hives and respiratory distress indicate a severe allergic reaction requiring immediate emergency treatment. Strategy. Recognize the signs of anaphylaxis and act immediately. Question 40. A nurse is assessing 4 clients. Which client should be seen first? A. A client with chronic arthritis pain rated 6 out of 10. B. A client with new-onset confusion and oxygen saturation of 86%. C. A client requesting discharge paperwork. D. A client waiting for scheduled medications. Correct answer, B. A client with new-onset confusion and oxygen saturation of 86%. Rationale. New confusion combined with low oxygen saturation suggests acute hypoxia and requires immediate assessment and intervention. This is a life-threatening condition. Strategy. Use the ABCs and prioritize clients with airway or breathing compromise and sudden changes in mental status. Question 41. A nurse is caring for a client who suddenly becomes restless, tachycardic, and short of breath. What is the nurse's priority action? A. Assist the client into a high Fowler's position and assess oxygenation. B. Offer oral fluids. C. Document the findings. D. Encourage the client to sleep. Correct answer, A. Assist the client into a high Fowler's position and assess oxygenation. Rationale. Restlessness and shortness of breath are early signs of hypoxia. Positioning the client upright and assessing oxygenation helps improve breathing while further interventions are initiated. Strategy. When respiratory symptoms suddenly worsen, always prioritize airway and breathing using the ABCs. Question 42. A nurse is reviewing laboratory results. Which value requires immediate notification of the healthcare provider? A. Hemoglobin 13.8 g/dl. B. White blood cell count 8000/mm superscript 3. C. Blood glucose 110 mg per deciliter. D. Potassium 6.2 milliequivalent/L. Correct answer, D. Potassium 6.2 milliequivalent/L. Rationale. Severe hyperkalemia can lead to life-threatening cardiac dysrhythmias. Prompt treatment is necessary to prevent cardiac arrest. Strategy. High or low potassium levels are Nclex favorites because they can quickly become life-threatening. Question 43. A client is receiving oxygen through a nasal cannula. Which finding indicates that the therapy is effective? A. Oxygen saturation increases from 86% to 93%. B. Increased use of accessory muscles. C. Respiratory rate increases from 20 to 34 breaths/min. D. Client becomes increasingly restless. Correct answer, A. Oxygen saturation increases from 86% to 93%. Rationale. An increase in oxygen saturation indicates improved oxygenation and effective oxygen therapy. Strategy. Choose objective evidence that demonstrates improvement. Question 44. Which client should the nurse assess first after receiving a change of shift report? A. A client with diabetes awaiting breakfast. B. A client with a new onset of chest pain rated 9 out of 10. C. A client requesting assistance with bathing. D. A client scheduled for discharge later today. Correct answer, B. A client with a new onset of chest pain rated 9 out of 10. Rationale. Sudden chest pain may indicate an acute myocardial infarction. Immediate assessment and intervention are essential. Strategy. Prioritize acute changes over routine care. Question 45. A client receiving blood develops fever, chills, and flank pain. What is the nurse's first action? A. Continue the transfusion. B. Stop the blood transfusion immediately. C. Administer acetaminophen first. D. Notify the family. Correct answer, B. Stop the blood transfusion immediately. Rationale. These symptoms indicate a possible acute hemolytic transfusion reaction. The transfusion must be stopped before any additional actions. Strategy. Remember the first step for any suspected transfusion reaction: stop the blood. Question 46. A nurse is caring for a client who has just had a seizure. Which action should the nurse perform first? A. Place a tongue blade in the client's mouth. B. Assess the airway and breathing. C. Offer food and fluids. D. Restrain the client. Correct answer, B. Assess the airway and breathing. Rationale. After seizure activity ends, airway patency and breathing are the immediate priorities. The client may require suctioning or oxygen. Strategy. For post-seizure care, think ABCs before everything else. Question 47. A nurse is caring for a client with suspected sepsis. Which assessment finding is most concerning? A. Temperature of 102.8 degrees Fahrenheit 39.3 degrees Celsius, blood pressure 82/50 millimeter of mercury, and confusion. B. Temperature of 99 degrees Fahrenheit 37.2 degrees Celsius. C. Mild fatigue after walking. D. Heart rate of 76 beats/min. Correct answer, A. Temperature of 102.8 degrees Fahrenheit 39.3 degrees Celsius, blood pressure 82/50 mmHg, and confusion. Rationale. Hypotension and altered mental status are signs of septic shock and require immediate intervention. Strategy. Recognize sepsis early by identifying infection plus organ dysfunction. Question 48. Which finding requires immediate nursing intervention in a client receiving 4 potassium? A. Burning and pain at the 4 site. B. Mild thirst. C. Increased appetite. D. Dry lips. Correct answer, A. Burning and pain at the 4 site. Rationale. Pain during potassium infusion may indicate infiltration or vein irritation. The infusion should be assessed immediately. Strategy. For potassium should never cause severe pain. Investigate infusion site complaints promptly. Question 49. Which statement by a newly licensed nurse requires intervention by the charge nurse? A. I'll verify client identification before giving medications. B. I'll assess pain before and after administering analgesics. C. I'll recap used needles before disposing of them. D. I'll perform hand hygiene before client care. Correct answer, C. I'll recap used needles before disposing of them. Rationale. Recapping used needles increases the risk of needle stick injuries. Used needles should be discarded immediately into an approved sharps container. Strategy. Remember standard precautions and safe sharps handling procedures. Question 50. A nurse is preparing to discharge a client with heart failure. Which statement by the client indicates that further teaching is needed? A. I'll weigh myself every morning. B. I'll call my provider if I gain 2 to 3 pounds in a day. C. I'll stop taking my medications once my swelling goes away. D. I'll limit sodium in my diet. Correct answer, C. I'll stop taking my medications once my swelling goes away. Rationale. Heart failure medications should be continued as prescribed even when symptoms improve. Stopping medications increases the risk of worsening heart failure and hospitalization. Strategy. For discharge questions, choose answers that demonstrate long-term medication adherence, symptom monitoring, and lifestyle modifications.